All right. Listen, it is 10:34 in the morning, and welcome to the program, and welcome to your healthcare partners, brought to you by GRMC, where patients are partners. And may I welcome and meet for the first time Vanessa Judicpa. Good morning.
Good morning, Ms. Patti Arroyo.
How are you, Miss Vanessa?
I'm doing well on this beautiful Tuesday, rainy / sunny morning.
This is like, I know, with the Christmas music going, I just feel like sipping like brandy in front of a fireplace.
Pumpkin chai.
Pumpkin. Okay, well, you said pumpkin chai. I went for the brandy. What a difference between you and me. You're a lab tech and Lab IT Analyst?
Yes, ma'am.
Okay. You got to tell me about this. Now, what does that mean exactly?
Well, I serve a dual role for the lab. Primarily, as the lab analyst, I act as the technical liaison between the laboratory department and the IT department.
Mm-hmm.
So when it comes to building laboratory tests for send out, basically to send to our reference lab, which is DLS,
mm-hmm.
Diagnostic Lab Services, we coordinate and do integrating testing with the IT team from DLS Hawaii location, and we coordinate the criteria also with the ITC location, and we do basically, the programmers do all of the their end on IT. What I do is to make sure that it actually works on our side, testing everything drops. So I work with various departments also, so I have to check with the billing department that charges drop in the test
mm-hmm.
environment. So we make sure that even if we have all the build available, that it actually gets charged.
So what we're talking about is swapping of information.
Correct.
Rather than runner from one location to another, you've graduated into this technology where the system can communicate with each other.
Yes.
Yeah.
Actually, what's important too is you hear about it in most hospitals, EMR, electronic medical record.
Yeah.
Sometimes it's also called electronic health record.
Mm-hmm.
So for that, it's very useful also for providers, because they can all log into the patient's information, and it's they work as an organization where they can see what the patient was prescribed. So that line of communication is open without having to basically call and find out everything is in one EMR system.
Mm-hmm.
So that as well.
This is not new technology. I had been treated in Honolulu, and that was the way I was admitted to the hospital, and that was
yes.
the line of communication.
Yes.
No charts. There's no mishandling of charts.
Yes.
It's a really efficient program.
Yes, it is.
There's a computer right by the bed, the patient's bed, and they just sort of log in the information. They're taking vitals or whatever needs that there are.
Yes, it actually provides quality care,
mm-hmm.
a lot more efficient.
Well, there's more people who have access to the information, right,
yes.
in a split second. What are the dangers, though, however? Because we would always assume that nothing is safe when it comes to record keeping and this kind of computer technology.
Right.
What are the safeguards against someone who is not involved in that patient's care getting a hold of that private information?
Well, we have an info security section for the IT department. So basically each employee has certain rights based on their position. So of course providers would have full rights to access the patient's information. But someone such as, let's say, a lab tech one, they're going to draw blood. It's not necessary for them to have access to that.
Mm-hmm.
If they do, it would be for viewing purposes, maybe to see what the provider has ordered and compare if it had transmitted over to our LIS system. But as far as that, everything else will be blocked out. They can't see what the history was, what the diagnosis was, for patient confidentiality.
So there's layers of accessibility.
Yes, and they're put in place for that reason.
Okay.
Yes.
So
Very HIPAA compliant.
Okay, that's what I was going to say. So a lab tech one wouldn't have access to what maybe the attending physician would have, or you for that matter?
Even me for that matter. Just because I'm the middle person between lab and IT doesn't mean I have full rights like the provider. Even if I were still investigate cases, if I needed something to be viewed at, I would have to go to our pathologist and say, Doc, I don't have this access. Could you please just to check if it's available? And even with that, she would have to see as to what extent she can look into it,
mm-hmm.
And if it even applies to the lab. So
who has complete access? The doctors have complete access?
They should, because that's their patient.
And other than that, the hospital not the administration, but billing?
Billing only, they
Or
would have
accounting?
modules and applications that are tied into the system. So we would have one main application, and then it breaks down to sub-modules. So finance would have, let's say, the SFM, like the finance module. So they would
And
look
that's all
Correct.
they would have access to.
Correct.
But you're talking about insurance companies have access to the entire thing. Not necessarily.
No, not necessarily,
Okay.
yes.
Okay. Well, how did we ever do it? You know, you know what I mean? How do we do it now? In some clearly there are facilities, institutions that don't have this kind of technology, and it sounds like it's an option.
Yes.
So it's an option that probably comes with a pretty hefty price tag. It would seem.
I would assume, but I think in the long run, it reduces a lot of paperwork. Just the turnaround time, the doctor can now make that deciding factor as far as should I discharge the patient, and they don't want to have to discharge without knowing what's the next step as far as proper care. So you don't want to also prescribe another medication that was already prescribed. So by having that as basically like a central hub, that line of communication is open.
Was this technology available from the time that GRMC first opened its doors? Oh, so this was all part of the master plan for this system
and
to be
go
in place.
paperless, basically.
Yeah. Was there some resistance? I'm sure there's some old school folks that go, God, I sure do need that folder. I really like to flip the papers because that's the way it was done, right?
Well, my mom is one of those people.
Really?
My parents, very, my uncle, very old school. But I mean, at any facility, even for facilities that don't have EMR systems, you could still go there to what they call the HIM department, which the Health Information Medical Records, and the patient would have to request that, and only that department at their discretion can release a copy. But
now that's a good question, because I remember a long time ago, and I'm not sure whether or not this is still true, because it really was like a couple decades ago, if not more. The doctor walked out of the office, and I'm looking through my chart, and they came back in and said, you can't do that. That you can't look through your own chart. Is that true, or is that? Would you know if that's true? Can you? I guess here's a better question, because maybe that was then, and it was just a singular event.
Good for that doctor, though.
Really? Why?
Yes.
Why is that?
Because doctors see multiple patients, so you don't know if maybe that doctor might have had another patient's folder.
Okay, and
it might have been like
swapped the chart or
correct,
something like that.
Yes.
Okay.
So to prevent.
It was a safeguard. It was a safeguard.
Yes.
But I guess the better question now is, can a patient look at their medical information, while they're there, as the information is being inputted? They can ask to see
they can request from their physician, and then they can generate that paperwork since they're right then and there.
They can basically print it out and let you take a look at it, a hard look at.
Yes. I always ask for my records.
Do you?
Yes.
I guess it also creates a better understanding, because some people's handwriting can't be deciphered.
True.
Yeah.
And I guess that's where the EMR systems come into place, because then it's typed up, and you can catch it's legible. But like I would request for records, because you never know when you're going to relocate to another area, and you start all
take
over
your records
there.
with you.
Yes, and if you have previous surgeries, you want to have all those documents in hand. You change providers, so I think just being a patient, you need to be so proactive in your health.
Yeah.
And as far as records are concerned.
So was this like a field that you wanted to get into? Did you study to do this specifically, or did you sort of land the field?
I stumbled across it by accident.
Did you?
Yes.
What were you doing before the accident?
Prior to healthcare?
Yeah.
I was actually an IT recruiter. I worked in the Silicon Valley. And so, during the dot-com industry in San Jose, I was all into, getting involved with startups. And then they had the bubble bust, the dot-com bust. And pretty much everyone I knew in IT wanted to get involved in some form of healthcare. And so I went to Santa Clara Valley Medical Hospital. I walked in, and I told myself, I'll just get lost here trying to find the HR. Went to HR, and then no one was available. I somehow stumbled across the laboratory department, and the lab manager back then, Pat Wood, she walked out of our office and she said, "Excuse me, miss, you look lost." I said, "Actually, I am. I'm just kind of getting the feel, what you have here." And she said, "Are you looking for a position?" I said, yes. And she said, did you check our website? I said, no, that would have been good, though. And so she invited me into her office, kind of had an idea of what my background was. And she said, would you like to get involved with lab? I said, I have no background. She goes, well, we need people that don't. So that you don't have bad habits from previous areas, we can mold you, condition you to our policies and procedures here. So I started out as drawing blood. And so I did phlebotomy in the morning, and then I would help out with histopath in the afternoon. And
that you had to learn a new skill. Then.
Oh yes.
You had to go. Did you go to school, or was it OJT?
It was OJT, and also it's a county hospital, so they actually let you take courses to get certified, and you have to be certified in the state of California. It's probably the most strict state out of all the 50 states. So if you get licensed there in healthcare, basically,
you can get a license anywhere.
Nationwide.
Yeah. Okay.
Yeah, they have really high standards.
Okay.
Yes.
So when you first had to draw blood, were you like, what am I doing here? This was not my thing? Or was it so fascinating you go out, you could build something from this?
Well, I'm always open to new things, and progress equals happiness. So any form of growth, even if it's out of your comfort zone. I mean, you have one life. Who says you have to stick to one set thing?
Yeah.
So eventually that's how I started, and I was trying to apply for the LIS department that they have there.
What's LIS?
Lab Information System.
Okay.
And at the time, it was male-dominated. I'll be real about it.
Okay, all right.
So they were kind of looking for someone that didn't have to worry about, like, oh, you're going to call out sick because you're on your period today or whatever it may be.
Yeah.
So, I figured, okay, I'll still, work on this skill set. And then I ended up becoming a trainer, and then having to do demos for Stanford interns in the maternity ward, how to draw blood culture from babies, newborns, and then I was there for a period of 8 years.
Wow.
Yes, and so I was really exposed to, working with different departments, and I loved working with patients. And then when I relocated back home...
Is this home?
This is home.
Oh,
Born and raised.
All right.
Yes.
All right.
Yes.
What school did you go to?
Notre Dame.
Okay. What year did you graduate?
Over the Royals. Shout out to my Royal sisters. I know you're listening.
Yeah, that is a Guam girl. She'll take... That's a Guam girl. She's going to take an opportunity to say hello to her classmates from how many years ago? How long
96.
has it been? 96.
Class of 96. If you're listening, I know you are.
That is so funny. So then you you graduated into what? I mean, from doing that and then into IT. Was that a natural progression because of your combined experience?
So after I graduated here, I moved to California.
Right.
And I got involved in IT because I figured it's, my parents would want me to get into something stable.
Yeah.
They want me to be responsible, so that's what I got involved in.
Well, how did you merge the two? How did you merge the skill that you had acquired as a lab tech into a lab IT tech? Was that the natural progression?
No, actually, my boss looked at my resume and he said, "Oh, you have computer background, and we're a relatively new hospital, so the technologists here, they just know how to work with the analyzers, but should we have problems as far as if things don't cross over and you have that analytical side, I think you'd be an asset for that. Would you mind considering this?" And because you've been in the lab area for close to 15 years, then you know the background as far as how the operations work, the workflows, so you can kind of have that understanding on using the verbiage and whatnot. So I said, okay, we'll see how this turns out, and it turned out pretty well.
Yeah, I guess so.
Yeah.
So did they recruit you from California to GRMC? Are you sort of like an off-island hire?
I came from GMH.
Okay,
hire.
All right.
Yes.
And so from GMH to GRMC, quite a big difference coming from a struggling public hospital into a facility that has all of the latest technology available to you. It was a big jump, huh?
Yes, it was a big jump because I did everything lab tech related in GMH, whereas with here I was doing more of the computer aspect.
Yeah, the IT stuff.
Yes.
Is there room for that at GMH?
They do have positions for it.
They do.
Yes.
I'm sorry. The technology is available there currently,
yes.
Or some of it?
Currently, I believe there.
Is it a full scale?
I believe they're paperless now.
Okay, well, that's good to know.
Yes.
I mean, that's the way of the world, isn't it?
Yes.
Yeah, and so this is an exciting, it's an exciting adventure to have come from what we all in our lifetime. I'm sure that there are people who will never know what that was like for
You're
a doctor to walk in with a chart and scribble on it.
You're right.
Or there are maybe people who haven't had to be, haven't been in a position that they could see this technology at work.
Oh, yes.
Yeah.
Yes, definitely. It is exciting, though. And I think for patient care, especially when you look at your population, like really populated areas such as California.
Sure. It's manageable. I mean, it's easier, right?
I mean, most hospitals now that I've known, and because I still contact my former colleagues there, they even have some hospitals where they have an app on your phone. And if you're lost, you don't even have to call an operator and say, where am I going? Or have, you can just go on that app and it will direct you.
The facility is so big
yes.
That they can direct you to the app like a Google map.
Yes, exactly. I mean, it's
like walk 10 paces and then
pretty
turn
awesome.
left.
Yeah.
Okay. So where do you think the next, new thing will be over at GRMC as it relates to IT? I mean, what else? What kind of technology is out there? What other advances have been made for patient care that would make the facility, even more efficient than it is now?
I believe they already have met those requirements. I can't think of anything else that they would have
that they're not doing.
Correct.
What's the next big thing though in the industry? Is there in the healthcare industry? Is there another really big thing that you see is that's on the cusp of breaking?
I've been reading up on accountable care organizations, ACOs, which is part of a Medicare program. On a side note, I read medical journals.
Okay.
I'm a nerd like that.
I'm just going to say. But that's okay because, that's how you get far.
I'm proactive in my health.
Yeah. Well, that's how you get far, too.
Yes. Yeah. So I've been reading up on accountable care organizations, and basically what it is that, like how we were talking about earlier in the example of like an EMR, where doctors are accountable for each other. So instead of, let's say, you going to one clinic one day and then you have to see another doctor who's going to fix another part of your problem in another office another day. So instead of doing that, and if the doctors if they're not under part of the ACO, how do you know they've communicated with each other that you've already seen this one for this issue?
Right.
So under the ACO program, basically your doctor that you're going to see Tuesday can already log in and realize, oh, she has seen this provider on Monday for this particular issue. Maybe then I shouldn't prescribe this in my counteract or whatever medication. So that ACO helps them communicate. So
even if it's a provider outside of the network or outside of
they have to be tied, somehow affiliated with that specific institution that's part of the ACO program.
Okay.
And I believe it applies to a lot of outpatient based labs.
Okay.
Yeah.
All right.
So like, let's say, for example, I know that in California, the Stanford Wound Care Clinic has an ACO program. And so their wound care hyperbaric is tied to like podiatry, it's tied to endovascular surgery. They can do referrals for like ENT. So you come in for a specific condition for a wound, and their goal is like a limb preservation program. So they want to coordinate that. They want to save your limb.
So they're going to enjoin anybody who is related to that
Correct.
specific treatment.
Yes. You may be a provider that has your own clinic elsewhere, but if you're affiliated with that institution and they're part of the ACO, they're able to communicate. So the patients save themselves a lot of time from like driving everywhere, and you can't assume that everyone has transportation.
Right.
And so,
which is the case on Guam.
Yes. So
running from doctor to doctor, yeah.
It's very convenient for the patient. I believe it's very efficient for the providers. There's that line of communication open. Communication is so key in healthcare.
Absolutely.
Yeah.
Absolutely.
So I've been reading up on that, and I'm just like, wow, this is the way to go.
Yeah,
and it saves those.
This is the stuff that turns on Vanessa right here.
Yeah, exactly. I mean, like, do you know how much money this saves facilities? Because it saves facilities, a lot of money. It reduces their costs.
Yeah.
Yes.
Vanessa Judicpa is the Lab Tech 2 and the Lab IT Analyst at Guam Regional Medical Center City. Are you there for the long haul? I mean, you see yourself at GRMC for a number of years. There's no other field you want to now go into?
Well, I do writing on the side. So I used to
Writing
work
with
for
a
PD
W or R with for riding a bike?
With both, actually.
Okay.
I used to work for PDN.
I see.
Yeah,
Okay.
freelance writing.
Yeah, and
Yes.
so that you're always that's
I'm
always
just
like a
working
first
on
love.
On my craft.
Yeah.
It'll always be my first
It's kind
love.
of a first love, yeah, exactly.
Yeah.
When you're once you've experienced it and got paid for it, there's something about it
I think the
that
pay
keeps
part
you.
is the bonus. The objective has to be the passion.
Absolutely.
Yeah.
I mean, that's exactly it. I mean, once you can realize it, it's a skill that people will pay for. It's like,
Right.
well, you're going to keep this skill going.
Exactly.
Well, it was really nice to meet you.
Oh, likewise.
And now I know if I run into you someplace, then I'll know exactly what you've done. I'll know your entire history. I appreciate your time. Thank you very much.
Thank you for having me. I appreciate it.
It's my pleasure. Call me and let me know if any, the next best thing actually comes,
of course.
and we'll talk all about it.
Definitely.
Appreciate it. It's about 5 minutes now before 11 o'clock. That's your Healthcare Partners, brought to you by GRMC, where patients are partners.